All right, next up, I want to bring out David Bowling, the Executive Director of OHCANN. David, come on out. I'll let David introduce his panel, but we're going to dive deeper into the rules themselves. David, I'll let you take it away. Let's give it up for our next panel, please. Thank you very much.
Thank you, everyone. As Patrick said, I'm Dave Bowling. I'm the Executive Director at the Ohio Cannabis Coalition. With me today, I have Greg May of Ice Miller, who's a practitioner in the cannabis space, and then Andrew Makoski from the Division of Cannabis Control. He is Chief Legal Counsel, the dreaded regulator, if you don't know who that is. But and then Tom Haren of Frantz Ward. So we'll get right into it. I encourage these guys to be a little bit chippy with each other, and then they kind of turned that on me and said, we're going to come after you. So we'll see how this goes. All right. So looking back, we're 1 year into adult use. What's your read on how the last year went? What worked well? And where did things get a little bumpy? And I think we'd start with Andrew's perspective first, and we'll get the other side after that.
I figured that was probably how it would go. Hi, good morning, everybody. Dave used to work with us. He used to be my boss, or my boss's boss. I'm not sure exactly where he fell in the line, but I know him pretty well, and kind of happy to be here for sure. Yeah, for the last year, I mean, it's been quite a whirlwind. You know, adult use sales started last year in August, so we're a little more than a year into that. And the division's been kind of really working to try to finalize the rules packages as they surround adult use. I'm sure most of you are aware we adopted kind of a novel approach of operating under the medical rules, but allowing sales to adult use consumers. It's interesting, it's kind of what some of the statutes, the SB 56 and some of the other ones have kind of taken that same tack. So we did that in order to try to begin sales kind of as quickly as possible. And then the rulemaking has kind of been catching up. So the last year for us has been big. We've certainly expanded a lot. We've needed more people. I'm at the Department of Commerce. I know that all the kind of old heads in the room remember that there used to be the Department of Commerce and the Board of Pharmacy, and it all got consolidated at the beginning of 2024. So we have spent the last kind of year and a half not only consolidating the regulatory scheme within the program, but also expanding the footprint. You know, I think that there's a lot still left to do. We learned a lot in this process, and I think that, you know, if there are further legislative changes, if there's additional licensing rounds that are going to come through, we've picked up a lot of tips on how we're going to approach those. But I would say that it's like a cautiously pretty successful year from that standpoint. I think that the launch went really smoothly, which is something we were worried about. And I think that, you know, the rest of it is kind of catching its way up. And, you know, I think that one of the things that we try to do really well in Ohio, at least, is that we talk to the industry. We talk to the industry groups. We talk to individual licensees. We spend a lot of time soliciting feedback. So before we make kind of these big sweeping changes or these, you know, even minor policy changes, we kind of know where everything is, and we try to explain to people why we're doing the thing that we're doing. They may not agree with it, but we can at least try to give them some of the perspective that we're looking for. So I think it's been a modestly successful year. I know that if my real boss was here, Superintendent Canepa, he would be coming out more guns blazing on it and saying this is the best launch that any state has ever had. I think that we, you know, I as the lawyer try to be a little bit more reserved on that side, but I think that we're pretty happy with where things have been, knowing that there's a lot still kind of left to come. And we have a real eye on the legislature, what happens with SB 56 or any of the changes that might come our way, so that we can kind of make the adjustments as we see them. So,
Tom, thoughts?
Everything that guy said is bullshit. I'm kidding. I think when you know, ask kind of how's the market doing here 1 year out, my question is always, as compared to what? The market is doing much better now than it was in 2022, 2021, before we had adult use. So the ball has been moved forward. But if you're comparing it to what were maybe some unrealistic expectations that the market had about what adult use would look like a year out, the market's underperforming. And so really, to me, it's all about what did you expect to happen a year out, especially considering the timeline under which, you know, folks wanted to begin adult use sales. One of the things that I know a lot of, you know, that I was grateful for, that a lot of our clients were grateful for, was the fact that the division worked really hard to begin adult use sales in August of 2024, at least 4 months before I thought that was going to be a realistic possibility.
Something they continually remind you of, by the way.
Yes, every time we talk to superintendent, he always reminds us, you know, I launched sales early. Thank you, Jim. But that also came with a trade-off. And the trade-off was we've been in this uncertain regulatory framework as well since August of 2024, where we're operating under the medical rules sometimes, under new rules when they actually go into effect, and then we're operating under these like guidance documents that the division issues, I don't know, every couple of weeks, every month or so, there's some new guidance that comes out to address something where there's like a gap between the medical rules and the new rules. And that has proven, I think, to be very challenging, certainly to our clients, but even as lawyers, when our clients call us and say, hey, what are we supposed to do about this issue? And then I look like an idiot because I'm like, well, I don't know, is the old rule in effect? Is the new rule in effect? Is there a guidance document? Did I save that guidance document in our document management system, or do I have to now hunt through my emails and do keyword searches? So that's proven challenging, because the one thing that has stayed true from the beginning is that we remain a very highly regulated industry. And it's not unusual for inspectors to come into our clients' facilities, or for me to get on a call with Andrew and his team and have them say, you know, your client screwed up, they didn't do this, 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 and this. And I look at like a rule and I'm like, I don't know, does the rule say that? And he's like, well, no, there was a guidance that was issued, 6 weeks and 4 days ago that maybe got caught in somebody's spam filter that they didn't realize. So I think we've made significant progress. I think the division has done a great job of allowing folks to start sales early, and that has had a meaningful impact on hundreds of thousands, if not millions, of Ohioans' lives who now have had access for the last year and a half to legal, regulated adult use cannabis. But the trade-off has been this really uncertain regulatory framework that we've operated under that will eventually get fixed as the new rules continue to come online. But now we've got the specter of the General Assembly, who from like day one has been trying to change what the voters passed, maybe for better, maybe for worse, but change creates more uncertainty from an economic standpoint. Business people can adjust to really onerous regulations or statutory provisions that they don't like. That's what business people are really good at. But it's really hard to deal with uncertainty, because you got to make a decision. And if you pick, door number one, but the legislation works out where door number one gets slammed in your face, well, now you got to pivot and go all the way back to door number two. So to me, that's been the trade-off. We've made progress, but there still is a fair way to go.
Greg with the rebuttal.
I don't have a lot to add because I think Tom just nailed it. Maybe a little bit more color. If we were giving the program, I don't want to call out the division specifically, but if we were giving a report card for where we are right now, let's say, I think Andrew touched upon the outreach and the effort that the division has been putting in to get the rules finalized. Okay, I think everybody agrees, like, the division has worked very hard.
He's only saying that because he needs stuff from me.
True, but they've worked very hard. There's been a lot of outreach to the stakeholders in the industry. They've really used that feedback to make changes to the rules, because at the end of the day, I think the division wants these rules to work just as much as the operators do, our clients. But the rules were supposed to be done by September 7th of 2024, correct? And here we are, and we're not there yet. So as Tom referenced, that has created a little bit of a gray area, if you will, in terms of, selling adult use products, but still having to comply with some of the medical rules. It's a little bit of a square, in a round hole kind of situation where it doesn't always fit. And where that really comes out, where it manifests itself, is in the operators not having clarity all the time on what it is they're allowed to do. And it really comes into play, I think, during this time with the advertising and some of the things that they really want to be able to do now that they're with adult use that they weren't able to do under medical because it was medical, and not really having clarity on what those kind of things are. We get calls a lot from people asking us to interpret the rules, and as Tom said, that's very hard to do when there's two sets of rules in play, and you have to constantly be monitoring, where we are in that process. On that, I guess I probably would give them a C-, but maybe a D. But honestly, we are getting there, and things hopefully during the next year, as we look back on the year 2, hopefully we're looking at those rules not only becoming final, but in practice, hopefully a year from now, we're at a place where the operators have more certainty on what they can do and less having to call, even though it's less work for us, just not calling us all the time and asking, what does this mean? What can I do? Because, the penalties are obviously severe in some cases, as you know.
You guys are so reasonable up here.
All right, so Andrew, with all that being said, where are we headed? For you, where are we headed? Are we headed for more flexibility? Are we headed for more restrictions? And I get that there's political issues at play there. And then for Tom and Greg, what kind of things are you going to be pushing for?
Yeah, I mean, I think that's a really good question. I think that I wouldn't frame it as more flexibility. I think that we would say that, the market will have shifted from my medical-only market to a hybrid. And that naturally kind of comes with a slightly different approach. There's things that you could speak about in terms of a recreational experience that would be inappropriate for a medical experience. So, we have a rules package that is currently somewhere in the process. I can't remember if we TBR'd this set or not, but there's an advertising rules package which is intended to open up a lot of these pathways to recreational advertising. We've been strict about the way that you promote these products in terms of the way that you feel, the way that you experience it, promoting like go to concerts, go on hikes, do these different things, because that's not really in line with a medical program. You take it for a medical condition, you don't take it to enhance your evening. But with the advent of these new, I think, advertising rules that we're promulgating, we're expecting to see people start to allow for those. That also includes different devices and things that wouldn't be appropriate in a medical market. Combustion in particular is statutorily barred, but under the adult use side, it's permitted. So I think that, I wouldn't call it more flexibility as much as we're adapting to the changing marketplace that we've got and recognizing that we're a year into adult use sales and people are going to expect to be able to do this. I think that we always, try to sort of do this very kind of slow march towards the future on all of these things. And I think that our operators, even more recently, will have seen that some of the things that were not permitted as far as advertising was concerned even previously, even before rules change, are now being allowed to go through, specifically because we believe that the market has shifted, it's more mature, and it's found a kind of a home in that place. So I do think that there's going to be a lot of changes. I think that people will find them to be more flexible sort of in their day-to-day operations, but for us, I think it has less to do with we're trying to make things easier, much more to do with it's a different marketplace than we had even a year ago.
Yeah. I mean, in all signs pointing to Vivek Ramaswamy as the new governor, I think that has a big impact on what's going to happen going forward. So.
I was going to say, I don't even have a picture up there because we are, generally a faceless manifestation of the power of the executive. So I do think that, that obviously makes a change. The people that are sort of making the top-down decisions have a large effect on what the day-to-day on the ground looks like.
Yeah, and Tom and Greg, from the client perspective, what's the biggest priority?
Well, there are lots of priorities. We only have about 8.5 minutes.
We're gonna keep going here.
So I think advertising is one of the big ones, particularly when the licensed regulated dispensaries are competing so much with places selling intoxicating hemp that aren't subject to the same advertising provisions. And that's where, just to touch even on the hemp piece, to me it's really about parity between the folks selling hemp products and the folks that are growing, processing, and selling marijuana products. The regulated marijuana space has been fighting with a hand tied behind its back for the better part of 6 years or so now. And so creating that parity when you're selling effectively in many ways the same exact product, but you're operating under two sets of rules, it sets up an imbalance in the marketplace. So I know that's something that a lot of our regulated marijuana folks are heavily engaged on in the legislature. But the advertising piece is really important because number one, you have to break through in today's environment to just get people to see you and to know that you exist. And when the licensed regulated industry is providing an alternative to the illicit market, providing an alternative to, unregulated or less regulated intoxicating hemp products, you need to be able to get your message out there so that consumers know where to buy products. We're about a year into, a year after Issue 2 passed, adult use sales had started, and my own sister asked me when we were having lunch one day, so is it legal now? Like, you can go out and buy it? And I was like, how do you not know? Like, this is all I've been doing for the last 3 years, that you can go and, go to a dispensary. So to me, advertising is a big piece. And then just generally reorienting the attitude of policymakers towards marijuana generally. And some of this comes with time as new generations either get elected or take jobs in leadership and policymaker positions. Like, you don't have to be afraid of marijuana anymore. If there's one thing Ohio has proven, it's that you can safely regulate this market and grow it. And the boogeymen aren't hiding around every corner at this point. And so, just even reorienting that perspective so that when either legislators are debating new statutes or the division is contemplating, changing rules or implementing new rules, like, where do you start from during that process? Are you starting from a place of, all right, we want to just make it like a little bit safer for consumers? Or are you starting from the position where it felt like policy was at, 8 years ago, which was, this is a bad thing that we are begrudgingly legalizing, and we want to keep it as tightly controlled as possible so that as few folks are using marijuana as possible. Like, I don't think we need, that attitude seems to me to have shifted quite a bit, but there are still some vestigial, it feels like, aspects of where that's at. I mean, Greg, I don't know what your perspective is.
Well, I mean, what I said before, is obviously something we're looking forward to, essentially more efficiency in the administration of the rules, not necessarily from the DCC standpoint in terms of how they work on the ground for the operators, but by far the question I'm getting the most from clients over the last several months has to do with intoxicating hemp. There's no question. This is to some clients an existential threat to what they're doing right now. And so I think, agree with everything Tom said, but this is a real problem. And there needs to be a solution, I think, in the next year. There really needs to be a solution in the next couple months because it's that critical. Just because we pass a law doesn't mean the problem is going to be fixed immediately. There's still going to be a lot of work to do once we do agree on a law and then eventually rules. Look, at the end of the day, and I don't have to tell any of the operators this, but market share is something that is very hard to claw back once it's given away. And what's happening right now is market share is going to the intoxicating hemp market. And, just because the legislatures agree to finally do something about it, like I said, it doesn't mean the problem goes away. We're going to be fighting this for a while. So hopefully in a year, though, we sit here and we're happier, much happier where we sit when it comes to that issue.
Let's talk about that real quick.
Can I take 30 seconds just on a couple of these pieces? Sorry.
Yeah.
I think that you made an important point of sort of like we need a level playing field. And I think that one of the things that is important to recognize is from the division's perspective, kind of from the top on down, the level playing field should not be us racing towards the bottom of attracting children, of not testing these products, all of those different things. It should be elevating the floor of what we expect. And I think that if there is legislation that is passed that hands any level of intoxicating hemp to the Division of Cannabis Control, what you're going to see is we're going to be treating these licensees the same way. We're going to expect them to adopt the same quality control standards, the same security standards, the same packaging and labeling standards, the same testing standards. The floor is going to have to come up. It's not the other way around.
All right, so just on that front, real quick, and you can be a short answer here. Should state government act before the federal government acts? And what does that mean if it goes both ways? I'm sorry, if the federal government acts first, what does that mean? If state government acts first, what does that mean?
These guys are better lawyers than me. They should take this one.
I think the answer is yes, they should move expeditiously. There's no guarantee as much as we keep hearing about a federal fix, first of all, I've been saying for a long time the only real fix is a federal fix. This problem was created by a definition that doesn't work in the federal in the bill that legalized hemp. The definition of hemp, but the definition of THC, it doesn't work. And Tom and I taught a seminar on hemp in 2020. I found it recently. It was called Industrial Hemp. And it's like this thick, and went through that and didn't find the word intoxicating hemp one place in it. I sent a screenshot of it to Tom. I said, do you remember this? He goes, I remember all 30 seconds of industrial hemp. And so, we're at this place where this was never really intended. And yes, the state needs to do something, but the feds do need to do something to truly fix it. If that fix happens, then it will have an impact on what we do here. But this is not a waste of time. It's a critical health, public safety problem right now, and it needs addressed. And we can't really bet on or speculate when the feds will do something.
That's right.
Yeah, look, again, it goes back to certainty and creating this level playing field. I don't know that anybody can ever count on the federal government to do anything about anything effectively. And on the hemp side, I think what that means is we need certainty at the state level, because even if Congress were to, pass a bill that says, no more intoxicating hemp, however that ends up, but, they close the door on intoxicating hemp. Well, you still have to enforce it. I mean, right now, how often do you see the FDA sending out cease and desist letters to hemp companies saying these products are illegal under the Food, Drug, and Cosmetic Act today? Well, they send a letter and then that's it. And so even if Congress does change the law, what does that mean from an enforcement standpoint? And if the federal government isn't going to step in to enforce it, well, then you need a state-level regulator who has a more granular understanding of the activities within, that particular state.
And to expand on that, our hemp law does not contain any regulations regarding the retail sale of hemp or hemp products, including an age gating law. So anybody if you walk into one of these gas stations and they're checking IDs, they're essentially doing that because they do it all day long anyway when people come in to buy beer, and that's what they've trained their people to do. You can say they're doing it voluntarily, but point is, regardless of what the federal government does, we still need those retail regulations in our hemp bill to be able to enforce, because the federal government is not going to be counted on to enforce this. And at the end of the day, our state will have to enforce whatever it is, and we need to start with having some provisions in the law that address that. What are the penalties if you sell intoxicating hemp products that are actually marijuana, et cetera, right? Those aren't there right now. They need to be there regardless of what the feds do.
All right, real quick, we're going to switch gears just a bit.
We're at time, my friend.
Okay.
Let's close it up.
No, Bustin.
We run a tight ship here, baby. Let's
You do
go.
run a tight ship here. Thank you, everyone.
All right, give it up for our panel, my friends. Thank you so much. Thank you, thank you, thank you. Great job, David. Thank you. What a great panel. Guys, we've had a chance to dive into the rules. We've had a chance to dive in with our regulators. Thank you very much. Appreciate it.